Good day to each and everyone. I am Rafaida Siampata. For today's video, I'll be discussing the Diamond-Blackfan Anemia. So before we discuss and learn everything about this Diamond-Blackfan Anemia, let me explain to you first what is anemia. So I know most of us know what is anemia, but still there are people out there na hindi pa alam kung ano yung anemia. So for the sake of those people, let me define what is anemia. So anemia is a condition in which the number of red blood cells or hemoglobin concentration within them is lower than normal. It means that anemia is a condition in which the body does not have enough red blood cells. When this happens, the blood cannot provide enough oxygen to the body. Remember, the body needs red blood cells to survive. The red blood cells carry hemoglobin. This hemoglobin is oxygen-carrying protein inside the red blood cells. Without enough of them, oxygen does not get to the body's organ. Without enough oxygen, the organs cannot work normally. In this picture, we can see two blood, which is normal blood at saka anemic blood. Sa normal blood, there are many red blood cells at saka normal hemoglobin. At saka sa anemic blood naman is mayroong fewer red blood cells and low hemoglobin. So now let's proceed to the Diamond-Blackfan anemia, which is the main focus of our discussion. So Diamond-Blackfan anemia, also known as required pure red cell aplasia and congenital hypoplastic anemia. So these are the other term for Diamond-Blackfan anemia. So Diamond-Blackfan anemia is a rare blood disorder that occurs when the bone marrow fails to make red blood cells, which are essential for carrying oxygen from the lungs to all the other parts of the body. This means that DBA is a rare blood disorder that affects people's bone marrow, preventing bone marrow from providing enough red blood cells, and the shortage of red blood cells resulted to anemia. Children with DBA literally don't have enough red blood cells in their body, in need of treatment such as steroid therapy, blood transfusion, or even stem cell transplant in order for their body to function normally. And we will discuss these treatments in later part of this discussion. So blood cells like the red blood cells are made in the bone marrow, the soft tissue, and the soft tissue in the center of bones that help form all blood cells. So Diamond-Blackfan anemia is a congenital pure red cell aplasia, means that this is a disorder that is present at birth and the bone marrow does not produce enough red blood cells. DBA is characterized by shortage of red blood cells, which usually become evident during the first year of life when the patient develops anemia. And the DBA name was named after the pediatricians Louis Diamond and Kenneth Blackfan, who described the congenital hypoplastic anemia or the Diamond-Blackfan anemia in 1938. So Diamond-Blackfan anemia is a rare blood disorder that affects approximately 5 to 7 per million newborn babies worldwide. It is an inherited in autosomal dominant pattern, which means one copy of the altered gene in each cell is sufficient to cause the disorder. So parents who have this DBA, either kay father or mother, have the 50% chance na maipas niya sa kanyang mga anak yung DBA. So, Diamond-Blackfan anemia is a chronic condition, which means people who have this condition will need lifelong medical care, so their healthcare providers can treat the inherited condition, manage treatment side effects, and monitor complication. As this DBA is a chronic disorder, there is an increased chance people may develop life-threatening medical condition. The DBA Registry of North America, a database with information about people who have this condition, shows 25% of people with DBA die by age 50 from related medical condition. Starting in their 40s, people with this medical condition have an increased risk of developing cancer that would be life-threatening. So people with DBA are more likely to end with certain diseases and conditions, including the cancer. People with DBA have an increased risk of several serious related to their malfunction in bone marrow. And here, these four are some of the cancers na pwedeng maging other complication ng mga DBA patients. So first is myelodysplastic syndrome. This is a type of cancer, a disorder in which immature blood cells fail to develop normally. This is a type of cancer in which immature blood cells in the bone marrow do not mature or become healthy blood cells. Next is acute myeloid leukemia. It is a type of cancer on the blood and bone marrow. It happens when abnormal young white blood cells called blasts begin to fill up the bone marrow, preventing normal blood production. When people have AML, blasts make copies of themselves quickly. This slows the production of red blood cells and platelets, causing tiredness from anemia and a risk of bleeding from a low platelet count. Next is the osteosarcoma. So osteosarcoma is a type of bone cancer that usually develops in the osteoblast cells that form bone. Lastly is the colon cancer. It is a type of cancer that affects the colon cancer, a colon, large intestine, or rectum. This is one of the patient with DBA named Noah Akaka. At the age of 16 is nagkaroon siya ng other complication disease which is the osteosarcoma. Fortunately is naging isa siya sa mga survivor ng DBA at saka osteosarcoma. Diamond-Blackfan anemia is a type of anemia that is a genetic disorder that happens when certain genes mutate or change. DBA is a genetic disease that affects the body ribosomes, which are smaller cellular structure that plays an important role in building proteins in the body. In rare cases, DBA in boys can be due to a mutation in a gene called GATA1, which controls the earliest steps of red blood cells production. About 45% of people with this condition inherit mutated genes from biological parents, either from the mother or father. The remaining cases result from new mutation in the gene and occur in people with no history of the disorder in their family. So it means in Diamond-Blackfan anemia is pwede rin hindi maging inherited siya from the parents kasi may mga patient with DBA na walang history ng DBA yung kanilang family. Causes of Diamond-Blackfan anemia. DBA can be caused by mutations in one of many genes including the RPL5, RPL11, RPL35A, RPS10, RPS17, RPS19, RPS24, and RPS26. Each ribosome is made up of two parts called the large and the small subunits. The ribosomal protein produced from RPL5, RPL11, and RPL35A are among those found in large subunits, while ribosomal proteins produced from RPS10, RPS17, RPS19, RPS24, and RPS26 genes are among those found in this small subunit. Approximately 25% of individuals with DBA have mutation in RPS19 gene. About another 25 to 35% of individuals of DBA have mutation in the RPL5, RPL11, RPL35A, RPS10, RPS17, RPS24, and RPS26 genes. Those genetic changes determine what kind of symptoms people have and whether those symptoms are mild or severe. Patients with mutation in the RPL5 gene have more serious symptoms than people with mutation in the RPL11 and RPS19 genes. Patients with RPL11 gene have thumb anomalies more frequently than people with the other types. Mutation in any of these genes are believed to cause problems with ribosome function. Studies indicate that a shortage of functioning ribosome may increase the self-destruction of blood-forming cells in the bone marrow, resulting anemia. Abnormal regulation of cell division or inappropriate triggering of apoptosis may contribute to the other health problems that affect some people with DBA. So symptoms of Diamond-Blackfan anemia. So here are the symptoms of Diamond-Blackfan anemia. First is the common symptoms of anemia symptoms. First is fatigue. This is feeling too tired and weak to manage your daily activities. Second is difficulty breathing. Third is the skin is paler than usual due to the lack of red blood cells. And other common symptoms are first delayed growth, which means children with DBA may smaller or shorter than other kids their age, and small heads. Healthcare provider may notice these symptoms soon after the children are born. And here are the least common symptoms for DBA. So first is physical differences as missing or misshapen thumbs. Second, heart condition like atrial septal defect. And lastly, kidney conditions like horseshoe kidney. Next is the physical abnormalities. So approximately half of individuals with Diamond-Blackfan anemia have physical abnormalities. So such as very small head size, this microcephaly, widely spaced eyes, which is hypertelorism. Next, droopy eyelids, which is known as ptosis. This right eyelid, this is the droopy eyelid. Next is smaller lower jaw, which is micrognation, this one. And short wave neck, abnormalities of their hands, so it may either malform or absent of thumbs like this, or ganito na triphalangeal thumb. Other physical abnormalities is low frontal hairline, a broad flat bridge of the nose, small low set of ears. About 1/3 of affected individuals have slow growth leading to short stature. Diagnosis for Diamond-Blackfan anemia. So, to diagnose the children if they have this DBA, healthcare providers may use several mga tests like complete blood count and bone marrow biopsy para malaman kung may DBA ba talaga yung children. So, diagnosis of DBA is based on these four results from the complete blood count and bone marrow biopsy. So, first is anemia before 1 year of age. Second, red blood cells are larger than normal, which is known as macrocytic anemia. Third, low reticulocyte count, which are new red blood cells. Lastly is normal bone marrow sample with only a few cells that will develop into red blood cells. Diagnosis for the Diamond-Blackfan anemia. The healthcare provider may use several tests to diagnose this disorder, like first, the blood test. Sa blood test is may dalawang test na ginagawa yung mga healthcare provider. First is complete blood counts and the reticulocyte counts. So complete blood counts, these tests measure hemoglobin, the oxygen carriers, protein, and red blood cells, the quantity and size of red blood cells, and the quantity of white blood cells and platelets. Sa reticulocyte counts naman, this test measure the immature red blood cells in your bone marrow. Sa reticulocyte counts is A low reticulocyte count may be a sign your bone marrow can produce enough healthy red blood cells to carry oxygen throughout your body. Next is the bone marrow aspiration and biopsy. In this test, marrow may be removed by aspiration and needle biopsy under local anesthesia and conscious sedation so that child remains calm and comfortable during procedure. And a bone marrow aspiration is a fluid specimen is removed from the bone marrow, while itong needle biopsy naman is a marrow cell, not fluid, are removed. These methods are always together, itong dalawa. Then additional blood test including genetic test is used to confirm the diagnosis or to test for other similar types of anemia that can affect children. Treatment for Diamond-Blackfan anemia. So, treatment for Diamond anemia is first steroid therapy, blood transfusion, and stem cell transfusion. So, sa steroid therapy is meron tayong sa steroid therapy, this therapy is given to increase hemoglobin by stimulating the bone marrow to produce more red blood cells, while blood transfusion is used when anemia is unusually severe or when steroid therapy is not effective. During blood transfusion, healthy red blood cells from a donor are given to the patient. And stem cell transplant naman are also known as bone marrow transplant. This involves replacing of deceased blood-forming stem cell with another person healthy stem cells. So unfortunately, it may not be an option for everyone. The success of a transplant depends on many factors such as how close the match is between children and donor and the patient's age. Matched siblings are best if the child has siblings. The chance of complete tissue match is 1 in 4. This type of treatment is risk or serious. So stem cell transplant is usually not done unless steroid or blood transfusion don't help. Side effect of steroid therapy. People may develop the following issues if they need to take corticosteroid for a long time or need high doses to boost red blood cells production. So these are the issues na maaring mangyari or side effect of steroid therapy. So first is osteoporosis, bone weakening disease, diabetes, high blood pressure, increased appetite and weight gain, lower resistance to infection, ulcers, cataract, or glaucoma. The side effect of blood transfusion, some people may develop the following issues if they need multiple blood transfusions. So first is iron overload. Excess iron from multiple blood transfusion may damage your organ. Healthcare provider watch for iron overload with blood tests and imaging tests to look for signs of iron overload. They treat iron overload with chelation therapy to remove excess iron. And delayed transfusion reaction. This side effect happens when donated blood cell died soon after being placed in people's blood streams. And healthcare providers typically begin the blood transfusions immediately after diagnosing the condition, usually before children are a year old, while they may start the steroid therapy or corticosteroid treatment when children are more than a year old. Life expectancy for Diamond-Blackfan anemia with current treatment, the overall survival of people with DB as reported by DB registry is 75.1% at age 40. Still, others live long lives and about 17% have maintained remission. Remission can happen after both steroid and blood transfusion therapies. Remission is defined as stable hemoglobin adequate for age, maintained for at least 6 months without any steroid and blood transfusion therapy. And Thank you for watching. That's all.